Hey, what's going on, everyone? I wanted to tell you a story about one of my patients. His name is Bob. And the story illustrates a point that I really want to get across today, which is when you're dealing with knee pain, shoulder pain, different things like that, a lot of doctors will go and order MRIs. And the MRIs are fantastic, or x-rays, whatever imaging they choose to order. It's great. And it's helpful. It's a helpful tool when trying to figure out what's going on with your joint pain. The thing that I want you to really understand, though, is that just because you have something on the image doesn't mean that's the cause of your pain. So I'm going to give you an example of Bob, who is an older male, active, loves to hike, is part of a softball league, all that stuff. He was having knee pain for several years. Went to multiple doctors, had cortisone injections, had hyaluronic acid injections, because x-rays showed that he had arthritis. He got, none of those worked. He had an MRI done, and then it showed that he had some cartilage issues. So then the surgeon decided to go and say, you know what, like, it's bad enough to where you need a total knee replacement. So we're just going to go ahead and replace your knee completely, and then that'll get rid of the pain. So he underwent the surgery. Surgery was, fortunately went well for him, except for the fact that even 6 months after the surgery, he was still experiencing the exact same pain in the exact same location that he was this entire time. So surgery didn't do anything to fix the pain. We took a look at his knee, or he came into my office. I took a look at his knee. I found out that the pain was coming from a nerve entrapment that he was having in his quad. And so I went in, I treated that, and that got rid of his pain within a matter of, I think, like 2 minutes. And he did a few more treatments, and then that was the end of the knee pain he was experiencing. But again, this is someone that got x-rays, showed that they had arthritis, got MRIs, showed that there was cartilage damage, and at the end of the day, the pain wasn't coming from either of those two things. You can go and get imaging done and have damage, like tissue damage, but unless we know that the pain is coming from there, it doesn't really matter as much. There's definitely stuff you want to do to address it, but at the end of the day, Bob's goal was to be able to run and hike and do all those things, and he wasn't able to do that because of the pain he was experiencing, neither of which the surgery, the cortisone, or the hyaluronic acid fixed. So again, take home message: just because that your MRI or x-ray shows that you have a certain problem going on doesn't mean that's actually where the problem is. So keep that in mind and make it a great day.